So, as the description says earlier on, tonight we're going to be talking about nurse leadership, and we know that leadership plays a really pivotal role in healthcare, and effective leadership is a multifaceted concept, but it's also something that, in order to get healthcare right for people, it really is important that you've got that good leadership structure there to drive change and to support people during that process. Today, we're going to talk about the practicalities of leadership style, how they impact nursing. We're also going to talk about how nurses shape healthcare teams and the impact that this, of course, has on patient care and actually thinking a little bit about the future of the nursing profession. I've got an excellent panelists here with you today, both of whom have got lots of experience in terms of leadership and of course unique insights that I'm delighted that they're able to share with us this evening. It's a topic that's very close to my heart because my master's studies was in leadership, and indeed my fellowship study was in nurse leadership too. So I think we've got a great panel here to talk to you this evening, and I hope you find this space interesting and helpful. So I'm going to start off by perhaps Gayle, if I could ask you first, what does nurse leadership mean, and why is it important in healthcare today?
Yeah, thanks, Vic. Thank you so much for inviting me along to join you this evening. Hello, everyone. Nurse leadership, I mean, what can you say? It's challenging, it's rewarding, it's exciting, and I think so important in nursing. I think to me, it's ultimately about wanting to make a difference and about being brave. Nurses, I think, are an essential cog in health and social care, and we're often at the heart of things, aren't we? We can see where things are perhaps not working as well as they could, or how things could be improved for the people that we're looking after and supporting, including colleagues that are around us. We're one of the largest staff groups within the NHS, and we have been for many, many years. So I think our influence really should be great. Given the chance, nurses at every level, I think, need to recognise themselves as leaders and believe that they can make positive change.
Perfect, thank you. And Gail, I have to apologise to you because I actually forgot to ask you to introduce yourself
Oh,
as well.
well,
That
no,
was very bad of
no
me.
problem at all, Vic. No, that's absolutely fine. I'm Gayle Madden. I'm a registered mental health nurse by background, and I'm now working as head of the Admiral Nurse Academy at Dementia UK.
Thank you so much, Gail, and my apologies for that appalling oversight. Suzanne, are you able to introduce yourself first, and then also answer the question about why you think it's important?
Oh, of course. Thanks, Vic. Yes. Hello, everybody. So my name's Suzanne Wightman, and I work in the Admiral Nurse Academy as well. I am part-time, but take a lead role in leadership currently. I'm an RMN by background and have a master's in advancing clinical practice. So that's me. I've been working for Dementia UK for the last 8 years and have been a nurse for 40 years, a long time. Nurse leadership and why is it important in healthcare today? Well, for me, it's about passion and purpose. You know, I look to see passion and purpose in nurses. I look to see vision and focus and some flexibility, but determination alongside. And for me, I've talked for a long time about that mix of compassion and passion. It feels like they are really the magic ingredients, that magical mix that can shape a nurse leader and really enable them to inspire and influence others positively. And I think this is really important, particularly, if there's kind of more of a medical model approach or the culture is challenging. We need to really be able to step up as nurses and inspire and influence and introduce that person-centered approach. I like to understand when I'm working with nurses what has brought them into nursing, what's fueled their passion for the role that they're in. and what their purpose is, why they want to make a difference. And really the pleasure of seeing a nurse find their purpose, understand their purpose, and have that confidence is such a satisfying thing. And to see everyone flourishing, all around, really, everybody involved. So this, along with a shared vision, I think can build a high performing team, and that's really key. Teamwork is really vital in healthcare. So alongside nursing, it's about how we work together in our teams of nurses or multi-professional teams. So good leaders can really enjoy their work and bring positive energy to the table. So it's about that flourishing, it's about well-being, and well-being for everyone. It's a bit of a win-win, really, if we can get it right, really. And I think it is really important in healthcare today, because the climate, as everyone knows, and the cultures in healthcare can be quite challenging. The workforce is under such pressure. And for good outcomes in health and healthcare, we do need leaders at every level, as Gayle mentioned, to be amplifiers, role modelling those great leadership behaviours and inspiring others to influence a positive culture.
Thank you, Suzanne. That was a great outline then of what leadership is, and some key things that I really liked there was that kind of talking about passion, and lots of people go into any profession for lots of different reasons, don't they? But when you're dealing with vulnerable people, people who are unwell, people who, systems that are stretched, I think having that passion is important for nurses, that they've got that drives them. And one of the other things that I think was really interesting is thinking about you mentioned nurses at every level, because I think there's a difference between leadership and management, actually. And it's yes, they can sometimes be the management, can be the leader, and it can get quite confusing, can't they? But I just wondered, could we have a bit of a conversation about that, about actually what is the difference between leadership and management? Is the manager always the leader, or vice versa? Around
I
that.
think that's a really, really good point, Vic. Yeah. I mean, as a manager, I think you should also be a leader, but actually as a leader, you don't need to be a manager. I think that's something that Suzanne and I are very passionate about getting across to all nurses out there. There are differences. There are quite big differences, I think. As a manager, you have to organise people. You've often got a plan and budget, think about what works. And I think you're looking at the more operational things, asking more operational questions, about the how. How are we going to do this? Who's going to do it? When are they going to do it? I think, you also have to reflect the status quo, perhaps, and do things right for the organisation, or for the NHS Trust, or whoever it is that you might be working for. I think as a leader, there's perhaps a little bit more flexibility. You might be managing people, but actually as a leader, you can inspire people. I think there's so much more space for innovation, creativity. I think, thinking about new ways of working, I think you can really influence change as a leader. And I also think there's that difference, because you can be curious and ask questions that are more the sort of the why, the what, and the what if questions, rather than the how are we going to do this, and what's our time frame for this, what's our budget for this. I think you can also challenge the status quo too. So it's perhaps not about doing the right things, but about doing things right.
Fantastic, thank you. And I think Suzanne, sorry, did you have anything you wanted to add on that?
Well, just to agree with Gayle, really,
Yeah.
that nurses really, don't have to be managers to lead. It's absolutely, leadership is at every level. And one of the things that we do find is many nurses come to, our course that we offer through Dementia UK, and they will say, oh, I'm not a leader. They don't always kind of recognise that potential. And so we're often working, with them so that they recognise they have got that influence and they can make positive change. But I think the other thing is that, there are many great managers out there who are great because they are primarily great leaders. So the leadership behaviours of everyone are absolutely key to success, I think, in this.
And I suppose it might be worth having a bit of a conversation here about different styles as well, because sometimes when I think about the kind of skills that you need to be a good manager, you often think about those kind of transactional styles of leadership where, you know, it's maybe some of the time it's about getting tasks done and jobs done, and like you mentioned, Gail, budgets managed and things moved along in a way that has to be done. Whereas of course sometimes it's very much about those transformational skills as well. But I just wondered, would one of you be willing to pick up and kind of give us a bit of a definition about what's the difference between transactional and transformational styles of leadership, and whether they do lend themselves more to different times and scenarios and situations? Is that one that you could perhaps pick up, Suzanne?
Yeah, absolutely. Yeah, so transactional. We're really kind of thinking about those, focusing on tasks and directional and hierarchy. Whereas transformational, we're talking about the ability to inspire and engage teams to drive forward improvements. And I think that's really where we're kind of supporting this, is to understand more about that transformational ability, really, that they have, how they can transform healthcare for people who are being supported by them, and how they can transform teams and services, essentially.
Thank you. I'm just wondering, because while we were talking as well, I'm thinking about some of the leaders that I've worked with in the past, and indeed the people I lead with now. And we you know when you've experienced a good leader, and actually equally you know when you've experienced someone who perhaps hasn't got some of the styles and skills that you might think would make them a good leader. I'm just wondering, have either of you got any examples of experiences where a nurse leader has actually made a significant difference, either in terms of patient care or team dynamics, or anything that you'd be willing to share with us?
Yeah, absolutely. Do you want me to go first,
Yeah, go
Gayle?
for it. Yeah, go for it.
Yeah, thank you. Yeah, I mean, for me, something really stands out regarding this question, and it was over 20 years ago, actually, when I was a new clinical services manager myself. So I was a new manager of a service, a number of wards and other services within that. And we had a failing ward, and we appointed a new ward sister. And she had a bit of a task, really. It needed a turnaround. And she worked so hard, really, with the team that she was with, and turned it from failing to flourishing within quite a short space of time. And she did this by really listening to all the staff, and listening to the families that they were supporting, and the individuals on the wards as well. And it was her listening, and we often talk in our leadership courses about listening with fascination, the Nancy Klein quote, and Michael West quotes Nancy Klein about listening with fascination. She listened to the staff that were burnt out and struggling, and she really enabled and empowered those staff, the nurses and healthcare staff on the ward, enable them to feel really valued through that listening and have their strengths and hopes really recognised. And as a result, she offered all the members of the team a leadership role and a purpose. And she linked that, for those of us that have more than 20 years experience in the NHS, you'll remember the essence of care, but she linked it very much to that. But they all had a leadership role, and lead they did. They really did. So they were energized and they were excited and they worked together. They each brought, vision and purpose to their role and started to transform the quality of care. It was a really exciting time to see the difference in that ward. And I was, a clinical manager, but we worked, together, and it was so exciting. And that ward sister is now a key driver and leader in Scottish healthcare and academia. So it's been a pleasure to sort of see her journey over the last 20 years. But for me, it's about also learning every day from people leading at every level, not somebody more senior necessarily, but, porters, nursing assistants, everybody at every level, families and more.
Yeah, I think you just mentioned something I was thinking about as well. I remember learning something so incredibly important about delivering some patient care when one of the healthcare assistants on the ward came and said to us very, very clearly that we would never do that in my culture. That's what you're trying to get this lady to do is the people trying to get her to have a bath after she'd had some surgery, and she would never have had a bath. And as soon as you learn that, you think, okay, that's a leader. We can. And she started talking about how we could put processes into place so that we were better identifying what was appropriate care for the patients we were supporting, and culturally sensitive care. So she wasn't the leader of the ward in the example I was thinking about, but she wasn't, certainly not the manager, but actually led a whole change process to enable us to deliver better care. Sorry, Gayle, I jumped in ahead of you there because it was just sort of fitted when you were talking about porters leading as well there, Suzanne.
Absolutely. Yeah, no, that's fine, Vic. It's really interesting to hear both of you talking. And actually, I'm reflecting, and I can go right back to being a newly qualified nurse, working on an acute mental health ward, and being really influenced by my ward manager at the time. And I don't think she just had an impact on me. I think she had an impact on the team and on the patients that were on the ward. I've got clear recollections of shifts that were always, there was always a sense of calm when she was around, within all of us. I think we felt that we were looked after. We felt she'd got our back. But at the same time, we had full respect for her because she got involved. She was always one of the first to support a person if they became distressed, within that mental health ward. And I think there was, that really stayed with me throughout my whole career, was that if I could create that same sort of calm when I was around people working in such high pressured environments, then that was a goal that I really wanted to achieve. So yeah, she really sticks out in my mind. I think about her often.
Well, it's great. We remember these people, don't we? It's clear when you've both spoken then about the way that thinking about these situations and experiences, just they stay with us. They those memories retain, don't they? Even as time goes on and we experience new things. I was thinking as well about I had a book when I was a child, which was a Ladybird book of nursing, and in this book, stay with me, it'll make sense in a minute. It talked about nurses as being they're there to do what the doctor asks. The nurses are there, and the doctor is the one who sets the tone and makes the decisions. And the nurse in the pictures was arranging flowers and doing kind of nice things like that. And it just made me think about actually how the role of nurse leadership has evolved over the years. And I was just wondering, what sort of other challenges that we think nurse leaders face now in modern healthcare landscape, and obviously some of the challenges we know, and you mentioned them earlier, Suzanne, about staffing, burnout, numbers of situations, limited resources, limited people. There's a number of challenges that we can all probably picture, but what could either of you what do you think these key challenges are in modern healthcare landscape for nurses?
Yeah, I'll jump in there if that's okay with everybody.
Yes,
Yeah, I mean,
please.
it's really interesting, isn't it? You say that about about that Ladybird book. I think as nurses, we have become more recognised as leaders in our field. I think it's growing. Certainly, it's better than it was. Like you say, we're no longer the handmaidens of days gone by. but there are real challenges, aren't there? I think managing, and maintaining the well-being of staff, I think for leaders is such an important and essential part of our work nowadays, but can also bring its own challenges, because alongside that, of course, you've got to think about yourself, and looking after yourself as a leader, but encouraging people, and allowing them the space, motivating them to think about quality improvement for the safety of patients. I think those sorts of things are top priority, but are perhaps not necessarily given as much attention as they could be, just because of all the pressures.
And Suzanne?
Yeah, I think I think with this question, I was reflecting on how in recent years, nursing and healthcare has become more collaborative, and we've seen a more compassionate style of leadership emerging. Some of which I think really became more evident, maybe post COVID and the pandemic period, where people had to collaborate in different ways, and that's seen a shift in things really for healthcare, although it's changing and settling again. But I think that compassionate style of leadership and that collaborative way of working, building relationships, has really been positively influenced by people like Michael West, who I mentioned earlier, and the King's Fund and the work that he does with the King's Fund. But those challenges, the challenges we described earlier, the workforce pressures are really there. They're much more evident than ever before, again, possibly influenced by COVID and other things. So recruitment and retention is really challenging. And we really have got this sort of influence of this. We need to really apply compassion, not only to the people we care for, but to ourselves. And Gayle mentioned well-being, and that is key. That self-care is really the foundation of good practice going forward, and applying that to our colleagues and caring for each other. So we have that flourishing. We have people who are a well-enabled workforce to move forward. So the challenge is that these issues, although we have become maybe more compassionate and more collaborative in our style and recognizing the need for that, but those very issues themselves, staff shortages and target focused care, the orientation that organizations can have on achieving targets and financial targets, etc., can really increase the stress in the workplace and lead to burnout. So the very opposite can occur, and we risk people going to the other end of that spectrum. Rather than being compassionate, they become, you see bullying and harassment in the workplace. So a vicious circle emerging, which is really, a sad outcome sometimes. And that's why leadership is so important, that we offer good leadership development and support to nurses and to healthcare professionals, so that they can work really effectively and be good role models and generate more and more leaders in the workplace, so that we don't have the risks that these challenges leave us with.
Thank you. And you've led me on nicely to my next question, actually, because what I was thinking is just to move us forward a little bit about outlining some of the qualities that make a great nurse leader, and I've shared into the nest, which is the bar at the top, some work of a lady called Helen Bevan, who some of you in the space may know, but Helen is somebody who talks frequently about nurse leadership. So her work is always a good place to have a look at, and somebody I've been fortunate enough to know for a number of years. So I always go to her work for that reason as well. So she's amazing. So I've shared that into the nest for people to click on and have a look. And if you want to do that, you'll stay docked in the space as well and be able to hear us talking. But can I ask you, what do you think are the good qualities? And can I ask you two questions at once here? So one is, what are the good qualities that make a great nurse leader? And the second question is, do you think these qualities can be learned? Are they something that can be developed, or are they almost innate qualities that you either have or you don't have? And I don't know who wants to go first on that. Gayle.
Yeah, go on. I'll jump in.
Go for it,
Thank you. Great question. Definitely. So I guess, Suzanne has mentioned compassion, and I think that probably really is a quality that is so important, certainly at the moment in our health and social care environment. I think it's not just about being able to empathise with people. It really is listening and understanding, and then actually acting on that as well, and supporting the people around you, having that ability to do that. And I think to do that, you probably need a really high degree of emotional intelligence, and I think that is something that is really essential for nurse leaders. So having that self-awareness, recognizing where you are, who you are, and what influences you, as well as having an awareness of the people that are around you, the context that you're working in, and what's going on for others that are around you. The other quality, I think, would be drive. I think you've got to have drive. It is a challenge, and sometimes I think nurse leaders will feel that they're banging their head against a brick wall, if I'm allowed to say that. But I think if you've got the drive and the passion, I think that is a really good place to start. The question about whether the skills are innate or learned, I mean, personally, I think that theory can definitely be learnt. But the practice of being a good leader, in my experience, comes over time, and it comes with experience. I think life experience, it really is a big teacher for all of us, and being able to understand perhaps what it feels like to be led, as well as to lead others, being able to look at yourself honestly and critique your own style of working. I think that takes quite a lot of maturity. I'm not sure how much of that can be taught from a manual, but I think as leaders, we need to allow space and time for nurses, for other healthcare professionals out there to reflect and to share experiences, to really help to develop some of those leadership skills and characteristics. I think if you attend leadership training, I think it's often just the beginning of a journey. And I think experience and reflection on practice are really essential for developing those skills.
Perfect. Thank you, Gayle. Suzanne?
Yeah, thanks, Vic. Thanks, Gayle, as well. And thanks for the mention of Helen Bevan as well, and putting the resource in there, because Helen is somebody that is a real influencer and shares amazing stuff. So if anybody has the time, just to give her a quick follow if they don't already on here on this platform. But so for me, I feel there's a real mix of those innate sort of qualities, alongside qualities that can be developed through different situations and different experiences that people have. And I think, through our lives, the experiences we have, really shape us and drive us in the future. I think formal study and development really can also help to shape us and facilitate our understanding and our thinking, our reflections, and influence our style, the way we work, what's our individual and unique style as a leader. So, as Gayle mentioned, I talked about compassion, and we all always or often talk about compassionate leadership, but compassion is a key quality. We talk about it alongside passion as that magical mix. But I also, alongside compassion, really admire certain qualities, the qualities of determination, somebody who is unwavering in their focus, and mission to achieve as a leader. Flexibility and humility are absolutely key, and there's some lovely work by Peter Skine, a book called Humble Leadership, which is a super read, really, if anybody has chance to get hold of that book, Humble Leadership. So humility is really key, and I think that's reflected through people's willingness to learn, and what we talked about earlier. But yeah, life and work experience, good and bad, in health and in life, healthcare and in life, can influence us all. But it's that willingness to learn with and from others, and being reflective, that really shapes us as leaders. So what is the consequence of that learning? How do we act on it? And how do we take it forward? So being flexible, being adaptable, and really, as we've mentioned right through this, because it does run right through as a strand of everything we do, that well-being, considering the well-being and perspectives of others. And sometimes it's also about being willing to take a risk as a leader and a nurse, being able to challenge, where some may not take the step to challenge, but being able to do that, maybe sometimes putting your head above the parapet, because not everything is always right. Sometimes things have to be challenged, and leaders, Gayle mentioned bravery earlier. We have to be brave, put our head above the parapet, and sometimes be the lone voice and wait for others to follow, and support. So yeah, that's kind of, those are important qualities for me, and how we develop them is very much about us and our style.
Thank you both, and I think just to add to it, for me, I think often as nurses we needs to be done. Actually, intrinsically, we're often close to the situations, and sometimes close to the answers or the solutions as well, and being brave and not being afraid to use your voice and to use your, communicate effectively but forcefully if you need to with people, to actually say, this is something we need to change. And I mean, we're talking to you, we work from Dementia UK, which is nurse-led charity. So, I think we're probably very passionate about nurse leadership, because our whole spine of the work we do is around enabling a model where nurses can lead that change and lead and advocate for best practice for the patients and our beliefs and the things we're passionate about. So, I think nobody should ever underestimate the power of having that passion and that drive to kind of push you forward as well, and to make changes. So I know we talked about whether it was innate or learned, but there is actually quite a lot out there in terms of education and training and things that you can do to develop your own practice. And of course, you've got to find these clinical opportunities as well, and develop on your knowledge that way. But what can you tell us a little bit about some of the courses and education opportunities that might be available for nurses who might be listening to this and thinking, do you know what, I'd like to do this, but I feel like a little bit more formal training or some kind of course might be helpful for me to develop my own skills and knowledge. What's out there for nurses?
Yeah, I think, as Suzanne rightly said, I think courses are a great place to start. It's certainly where I started. I felt that it was something that would kick off the thought processes, I guess, and the ability to reflect. And there are a lot of leadership courses available these days. I mean, some of our listeners might be aware of the NHS having its own leadership academy, which is a fabulous resource, and it offers courses to all nurses, which is great, at all different levels and with all different different lengths benefits, of course, and different sort of purposes behind those courses. So I would absolutely encourage nurses to kind of go in and have a look at that. But you can also look out for local courses that are often, I think, run these days by healthcare trusts themselves. So they will have within their own learning and development departments, they'll have, their own learning leadership courses. But I think if you then take it that little step further, there are also opportunities to apply for scholarships. So the scholarship for the Florence Nightingale Foundation leadership courses, for example, they have some fantastic opportunities now. And the King's Fund, as Suzanne has mentioned, both Suzanne and I have been lucky enough to be involved in leadership courses with the King's Fund, which have just been fantastic. So, there is a lot out there. I guess a point that I would probably want to make here, though, is that, the challenge for nurses as individuals is that organisations need to demonstrate that they value their staff by allowing nurses to attend these courses and to fund them when they're required, because I think that is often a barrier to our healthcare workforce these days, is that there's just so much going on that extra curricular training, as it might be seen as, is not given so much of a priority. But the payback in terms of care delivery and what nurse leaders can offer is just phenomenal. So
perfect, thank you. Suzanne, could I ask you to tell us a little bit about some of the stuff we've done at Dementia UK to develop our leadership in our Admiral nurses, because I know that you've been heavily involved in that work. So would you be able to talk to us a little bit about that?
Yeah, absolutely. I suppose one of the core things really is the leadership course, which Gayle and I established over 4 years ago now, over 4 years ago. And we sort of identified, that there was a gap. We had brilliant Admiral nurses, clinical, with clinical expertise that we were supporting, but we recognized there was even more potential. So we wanted to really do something about that and try to, optimize that through developing the leadership course. So it started as a face-to-face opportunity back in 2019, and that was us really piloting the opportunity. Was this something to take forward? And now it's a regular part of our offer. And obviously during 2020 we had to quickly redesign the work that we were doing because we couldn't be face to face. But actually things really turned out really well. We could support a lot of people twice a year to come to courses and enable them to develop their leadership skills and styles and be supported beyond that. So over time, the leadership course evolved into a leadership pathway. And what we have now is a partnership beyond that with the Florence Nightingale Foundation. So we are able to offer people the opportunity to apply for a bespoke Admiral Nurses course, which is a follow-on really to the one we offer. And that's just a great opportunity, a great collaboration between both of the organisations, us and the Florence Nightingale Foundation. So there is that opportunity, but we also have resources that are available to nurses. We have some funding available to nurses, and we offer coaching to nurses through the pathway, and support with innovation, development of initiatives and project work. And just that opportunity to reach out to peers is there as well. We have an annual event, which is an opportunity to celebrate, which is something we feel is really important. People need to celebrate success and have fun and engage with each other. So we invite all our nurses that have been through the leadership course. They're an alumni member, if you like, and we celebrate with them annually in November. So that's actually coming up just in a couple of weeks' time. And we bring speakers in, and we select a theme every year based on what's been identified through our work with the nurses. And actually that theme this year is self-care and well-being, which is such an important foundation. So there's really now, from the very early days in 2019 of the idea and the implementation of a face-to-face course, we now have a really full offer for our nurses, and we're in the process now of developing that even more and expanding our leadership team, always thinking about the future proofing, being relevant, and really doing the best for our Admiral nurses that come through the pathway. Have I covered everything there, Gayle?
Oh gosh, I think so, probably. I think so. That was very detailed, wasn't it? Gayle, was there anything you wanted to add?
But I think you're absolutely right, Suzanne. You've covered it beautifully. The only other thing I was thinking about while you were talking was that we have now also just started to think about a foundation course to add to the pathway, because at the moment the opportunity for the leadership course is to a certain amount of nurses per year, because obviously we can only run the course so often, and we try and keep the numbers relatively small so that the nurses feel that they've got a safe space and that they can share their learning and reflections in that safe space. But what we recognise is that as Admiral nurses, all of our nurses are leaders without a doubt. And so we are looking at developing a foundational course that all the Admiral nurses that join, and become an Admiral nurse will have the opportunity to undertake. So yeah, just an added little extra.
Thank you. It sounds amazing, doesn't it? It sounds so good. So well done, both of you, for everything that you're managing to achieve for all of our Admiral nurses everywhere. I think it's fantastic. Can I take you back outside of Admiral nursing again? Because one of the things I was thinking about as well, I'd like to have a conversation about, is how, as nurses, we can do something to address diversity, and whether a nurse leader can actually do something to help address some of the issues that we know are there in terms of growing a more diverse example of leadership, more diversity across our leadership teams. And how can we help to promote this, and address some of the issues around diversity, equality and inclusion within healthcare and patient care? It's quite a big question, so I hope that made a bit of sense.
It is a big question, you're right, with probably a very big answer. We could probably spend the whole hour talking about it, couldn't
and
we?
we've got 15 minutes left, but I
Yeah.
can't not ask it.
I know. And it's absolutely right to ask it, isn't it? Without a shadow of a doubt. I think it's about understanding the unique health needs, isn't it, of our population. So you've got to know your population as a nurse leader, know your workforce, know who you're working with, because it's really, I think, about creating a culture that is inclusive. We've got a role model as nurse leaders. We've got to be proactive in noticing and and shouting out and addressing any negative behaviours that we see that might be discriminatory in some ways. I think that there's a need to champion policies that promote diversity and equity and inclusion. That they're so important, but I guess it's understanding different perspectives, and that includes your own perspective as well. I think it's really important to consider where our biases lie, because I think we all have them, and acknowledging that and exploring that. So becoming consciously aware that they're there, I think is really important in making sure that doesn't interfere with our decision making, and will improve us all as leaders.
Thank you so much, Gayle. Suzanne, anything you wanted to add there?
Yeah, I think I agree with what Gayle said, everything that she said there, really, but particularly about how nurses and nurse leaders can act as positive role models, in all these things, championing diversity, championing those policies that promote diversity, equity and inclusion. So that's absolutely key, and leadership, I think, is is the way to go in terms of role modeling and developing those good role models. And we've talked about Helen Bevan already, but some while ago, she shared a lovely graphic illustration on this platform, and she quoted alongside that graphic that as leaders we are amplifiers. Our words and actions are scrutinized and interpreted by those we work with and lead. Never underestimate how much our leadership behavior scales. And I think that is something that can be underestimated, but really to promote great cultures, inclusive, working places. I think we have to continually develop good leaders and good role models. And it's a lovely graphic about that amplifier effect, and perhaps we can share that in this nest really. But she also has talked just very recently actually about kindness and authenticity, and how they're so important in our cultures at work and supporting positive cultures. And she shared a practical guide to kindness in the workplace, which has been produced by a group called Hacking HR. It can be downloaded, so again that's something to share here in the nest, that practical guide to kindness, which again should not be underestimated in relation to all of this. She describes really how that culture of kindness, they describe Hacking HR, that is, how a culture of kindness can create an environment of trust, safety, belonging and inclusion, which is a great and strong foundation for any workplace, and one we really need to promote more and more, so that we do deliver great care.
Thank you, Suzanne. I've shared the link to the guide into the nest, so that's
Thank
I'll
you.
see if I can find the one about the amplifying, or indeed if Gayle, if or Suzanne, if either of you can bring it as well, that'd be great.
Okay.
And I guess for me, in terms of diversity, if we want to serve a diverse population, which we do because that's where we live and what we're dealing with, we have to have diversity all the way through, because otherwise, how do you know what you're doing and the solutions you're putting on the table are even the right ones? If go right back to the start where I talked about my example of delivering healthcare to somebody, if we hadn't got that diversity in our workforce, we wouldn't have actually realised what we were trying to encourage patients to do was actually not appropriate. So I think it's about having people with a loud enough voice, from all backgrounds, from all cultures, who can speak about actually what's appropriate. What do I need to speak about? How can I enhance the experience for our patients, and make sure that we can deliver the excellent care that we want to deliver to patients. We're really wrapping up now because we're getting towards the end. These spaces always go so quick, but it feels right at this point to think a little bit about the future. What trends do we think might shape the future in the coming years? And obviously, or perhaps not obviously if you don't know who I am or what I do, but I'm very, very influenced by thinking digitally and thinking about AI, and obviously nowadays lots of nursing is done remotely, lots of teams using various apps and AI technology to do their work. We've got virtual wards and virtual care, and I was just wondering, what do you two think the future of nurse leadership might look like? What trends do you think are coming down the line, and what do we need to do to make sure we're ready for this future? Again, we're going to have to be brief because we're crunching up against it. But
I will try and be brief. But you're the expert in this area as well, Vic. So happy to listen to you talk, because you talk so passionately about it. But I can see nurse leadership continuing to flourish. In all honesty, that's what I'd like to see. I do believe that we have a voice, and that we can create and influence change. And I think we are certainly starting to do that so much more now. And it can only get get bigger and better. I agree with you. I think the world is going to become much more digital. It already is. COVID, I think, had a huge impact on that. It turned things around much more rapidly, I think, than than perhaps it would have done had that not happened. And especially in our world, which is learning and development. And as Suzanne rightly said, you know, in 2020, when COVID came along, we'd only just begun our leadership course, and it was face to face. But very quickly, we had to adapt, like many others, and move it to the virtual world. But I think we did it very successfully. And I think what we found is that it's offered the same opportunities, but to a much wider group of people because of the availability. So wherever they are in the country, you know, our nurses can now have access to this. And I think, you know, there is something really powerful about how digital can support that inclusion, and create lots more opportunities for us. So I'm excited to see where it goes.
Yeah, I think it is exciting, isn't it? And I think I was at a conference recently where they were talking about some of the AI equipment that's used in hospitals now to analyse scan results, to listen to conversations, and be able to then transcribe it so that you don't have nurses and practitioners needing to spend 30 minutes writing a note, because it can instantly transcribe through, and using listening technology and AI imaging, spotting things that the human eye, as well trained as it may be in spotting shadows on scans, the AI technology, of course, was able to pick it up clearer, and find things that people were going to miss. I think one of the other big transformations that we're likely to see is that people will become more in control of their own health. So we're going to have patients who actually are able to communicate with the people who are providing their health in a much more digitally agile way. And also by doing so means that there's data analytics that you can use, because you've got an email trail, you've got a thread that you can look at where, you know, it's not you say to the doctor that they then have to hear it. It's documented, it's there, which actually means we'll probably start using documentation and those written forms of communication more going forward than we do now with our patients, which, whilst that might seem a bit eek on one level, you know, from both a patient point of view and also from somebody who provides care, it actually means that you're giving more power to the patient, because they've got that documentation, they've got that record, they've got that way of communicating, which actually is vital, because we shouldn't be passive participants in our own healthcare. We should, as service users, be driving and advocating for the things that we need. Suzanne, was there anything you wanted to add there?
Well, I think you've said it all there, really, between yourself and Gayle. I suppose from a personal perspective, I am really passionate about the compassionate leadership and person-centered leadership that Dr. Sean Cardiff talks about, and the work of those two as leaders. And I would really love to see those flourishing in the future, and really, you know, transforming the relationships that are out there for teams and for those teams delivering care, enabling, you know, better care and outcomes for people that seek out services. But totally agree with you both, really, about all the developments that are taking place, and what you said, Vic, about, you know, the control being with the you know, the user of services. Really, it's you know, about having that autonomy to, you know, and you know, shaping your own healthcare for the future.
Yeah, it's exciting times ahead.
Yeah.
It certainly is. So I'm just going to ask you both to help me wrap up. So as we said earlier on, you know, lots of people could be potentially aspiring to be a nurse leader. You don't necessarily have to be the person sitting as the expert who knows everything to be the leader, but somebody who's curious, who's learning, who's exploring, who's passionate about a subject. But if you were able to give a piece of advice to somebody who is maybe a young nurse, someone who's aspiring to be a leader, or somebody who is maybe already on that leadership journey, but is maybe not always entirely sure what they need to do next or how to do it, what advice would you give to somebody?
Shall I go
Go
first?
for it. Go for
Okay.
it.
Yeah, I mean, you're absolutely right. You can be a leader at any point in your career, is what I would be saying to anybody that I speak to now. I think, it's important for you to think about why you want to be a leader, and if the purpose of that is to make change that's going to benefit the people that you are caring for, that you're looking after and supporting, then you are absolutely moving in the right direction. So I would just say use that passion and that drive to influence others and to make change together, and that will make you a leader.
Fantastic. Thank you very much. Suzanne, what do you think?
Yeah. As Gayle has said, it's I think recognizing someone as a leader, recognizing themselves as a leader, what's their leadership story and what drives them. So finding that purpose, as Gayle has said. But my advice to somebody starting out who is really passionate, who recognizes the story and is driven, is seek out mentors, seek out coaches who can support you, and opportunities as well that facilitate growth as a leader, because it is all about that. I would say listen and learn. I would say read and reflect and build these things into, the thread of your life, really, and celebrate success, because it's about, bringing energy for everybody, really. So, yeah, those are my bits of advice for new nurses.
I love it. It's fantastic. So I guess the bits that I would probably say is start off by developing really strong clinical skills. Actually know your skill, know your craft, so that you've got that solid understanding of actually what you're trying to do, and having those skills really honed down, so that fundamentally you're reliable, you're safe, you're well skilled. And I think that's a good starting point, because we're clinicians. I always have to talk about communication skills, be an effective communicator, but an effective listener, so that you're hearing and you're aware, and you're close to the ground. I kind of always get a bit sort of wary of leaders in lofty towers. I think you need to be somebody who's actually able to communicate. Use emotional intelligence and empathy, so that you're empathetic, that you're understanding your patients and understanding your staff and your colleagues and the teams. I love that you mentioned mentorship, and we didn't talk about it earlier, but so thank you for getting that in. I think that's vital. And I guess the other key part for me, for any leader, is always, always, always remember your patients. Advocate for your patients. Advocate for nurses as professionals. But essentially, it's about patient advocacy, being a strong advocate for your patients. Understand their rights, their needs. Make sure that they receive the best care that they can. Because if you keep that as your backbone, I think you're not going to go far wrong, for me. So that's probably the key take homes that I would say. And then I guess I can't not also say about embracing diversity and inclusion, because that's something anybody else who knows me knows I'm passionate about. How do you do that to make sure that the workplace that you're in is really embracing diversity, and there's inclusion in your practice, and respect and understanding those cultural differences, and being a leader who actually celebrates diversity, and ensures that it's woven into, in a very creative way if need to be, but woven into those environments that you work in. So I feel we've wrapped up, ladies. I know we haven't had any questions come in this evening, but we've shared some resources that hopefully you found helpful.